Welcome again to the Postgraduate Paediatric Orthopaedic video series. Dr. Mohamed Kenawey in the last video took us through an overview of Gait analysis. In this video, he will take us through kinematic charts. And in the subsequent videos, he will take us through kinetic charts and electromyography.
Kinematics and gait analysis. What are the goals of this presentation? Understanding kinematic charts and gait analysis, trunk kinematics, pelvic and hip kinematics, knee kinematics, ankle and foot kinematics, foot rockers. This is how the kinematics charts would look in the 3D gait report with components for sagittal, frontal, and transverse kinematics. What is kinematics? Kinematic data correspond to the angular variations of the different joints segments: ankle, knee, hip, pelvis, and trunk. The raw data are measured by an optoelectronic system from the position of passive reflective markers attached directly to the skin of the patient. The model then permits the computation of the kinematics, joints movements and angles, the angle between two adjacent segments in a specific plane. In our discussion, we will also mention two types of muscle contractions. Concentric generates power and accelerates the body forward. Muscle shortens. Eccentric slows down and stabilizes joint motions during gait. Muscle lengthens. We will start with sagittal plane kinematics, which is easier to understand than the frontal and transverse planes. The pelvis. In the sagittal plane, the pelvis is tilted anteriorly approximately 15 degrees, remaining almost stable in both the stance and swing phases of gait. The hips, initial contact, the hip is flexed. Stance phase. The hip extends fully as the body advances over the planted foot. Heel rise and push off. The hip flexes rapidly to pull the stance limb off the ground. Swing phase. The hip continues to flex. As we can see in the kinematic chart of the hip, the gait cycle starts with the heel strike, and there is initial hip flexion to about 30 degrees. The gluteus maximus starts to contract concentrically to initiate progressive hip extension during the stance phase. The hip then extends fully during the stance phase as the body advances over the planted foot, reaching about 5 to 10 degrees of hip extension during the terminal stance phase. At the start of the swing phase, during heel rise and push off, the hip flexes rapidly to pull the stance limb off the ground, with the rectus femoris contracting at this stage. The hip continues to flex to a maximum of 30 degrees during the mid and terminal swing phases, aided by the active concentric contraction of the iliopsoas and rectus femoris muscles. The knee. Initial contact. The knee flexes approximately 15 degrees, buffering the acceptance of body weight through knee flexion. Stance phase. The knee then extends to a neutral position or minimal flexion. Heel rise. The knee begins to flex again, reaching maximal flexion in the early swing phase to allow the foot to clear the ground as the limb advances. Swing phase. The knee extends passively during the remainder of the swing phase, aided by forward momentum. At initial contact, the knee flexes approximately 15 degrees during loading response, buffering the acceptance of body weight through knee flexion. The quadriceps femoris contracts eccentrically to control this knee flexion. The knee then extends during the stance phase to a neutral position or minimal flexion. This extension is produced by the concentric contraction of the gastrocnemius soleus muscles, particularly the soleus, which is responsible for the knee extension ankle plantar flexion couple during push-off. At heel rise, the knee begins to flex again, reaching maximal flexion in the early swing phase to allow the foot to clear the ground as the limb advances. This is primarily passive knee flexion caused by progressive hip flexion, driven by iliopsoas and rectus femoris muscle contractions. During the remainder of the swing phase, the knee extends passively, aided by the forward momentum of hip flexion and active quadriceps contraction during the terminal swing phase. We can now look at both hip and knee kinematics together. At heel strike, the hip is flexed about 30 degrees and the knee is fully extended. With loading, the hip starts to extend, and the knee flexes about 15 degrees to buffer body weight loading. The hip and knee then extend to neutral during the mid-stance phase. During terminal stance phase, the hip reaches maximum extension of about 5 to 10 degrees, and the knee is extended during toe-off through the knee extension ankle plantar flexion couple caused by the concentric contraction of the soleus muscle. In the early swing phase, both the hip and knee start to flex rapidly, with active contraction of the iliopsoas and rectus femoris muscles actively flexing the hip, while the knee is passively extended by the forward momentum of hip flexion to help clear the foot off the ground. During the remaining swing phase, the hip continues to flex and the knee fully extends through quadriceps muscle contraction, prepositioning the limb for the next heel strike. Ankle kinematics in the sagittal plane. Ankle kinematics in the sagittal plane start with a neutral ankle at initial contact when the heel normally strikes the ground. The three rockers, Jacqueline Perry. 1. First rocker. The ankle is neutral at heel strike, then plantar flexes 5 to 10 degrees as the forefoot comes to rest on the ground. This is known as the first rocker. 2. Second rocker. The ankle dorsiflexes throughout mid-stance as the tibia moves forward over the plantigrade foot. 3. Third rocker. The ankle plantar flexes and the heel rises to prepare for push-off. Dorsiflexion of the ankle back to a neutral position occurs during the swing phase to allow foot clearance. The first rocker. Heel strike to foot flat, 10% of the gait cycle, controlled by the eccentric contraction of the tibialis anterior. Second rocker, foot flat to heel rise, 40% of the gait cycle. Soleus contracts concentrically at the end of this phase to initiate heel rise. Third rocker, heel rise to toe off, a 10% of the gait cycle. Gastric soleus contracts concentrically for the knee extension ankle plantar flexion couple. Coronal plane kinematics. Pelvis. During the stance phase, the hemipelvis rises on the contralateral swing leg to aid foot clearance. This is driven by hip abductors on the stance limb. Hips. Each hip slightly adducts during the stance phase and abducts during the swing phase to assist with limb clearance and progression. Transverse plane kinematics. Pelvis and hips. Minimal transverse plane rotation occurs during gait. Forward pelvic rotation is coupled with internal rotation of the stance hip. Backward pelvic rotation is coupled with external rotation of the swing hip. Foot progression angle. The tibia has mild external rotation with a normal foot progression angle of approximately 10 to 15 degrees externally.